You once told me, though, that as a surgeon, you've largely been trained in almost every other type of surgery, right? I mean, if you had to, you were out in the wilderness and you had to do a different kind of surgery, you have skills there.
So I think, for folks, I'd say make connections with others, keep developing those strong connections. If you're lucky and you come from a family or other support system that's strong, keep nurturing that and appreciate that and be thankful for that. And we can all learn, let others know about that.
I mean, he's a singular figure in history, in American history, where he had to make some very, very difficult decisions.
Hey, so this week, as you know, I constantly am looking at interesting things that just fascinate me, and then I love to get your perspective on these things. So I have a question for you. Have you ever heard of the Great Emu War of 1932? Does that ring a bell?
I'm not sure I know what emu is.
Oh, okay. Emu is like an ostrich, but
smaller. Right. Okay,
yeah. Emu. It looks like an ostrich. They're actually. There was a period of time that emus were becoming a fairly prominent form of ranching. That you could get emu burgers, and remember that they were using this as food. So it was kind of like the new turkey, the bigger turkey,
the new nutria.
Yeah, I wouldn't say it's like a rat.
Well, nutrias were like this is our future food source for a while.
Was it really?
That was the PR out of someplace in Louisiana.
They're like big rats, right? I mean, they're like big. I mean, and
tastes like chicken. Tastes like chicken.
Everything tastes like chicken. Yeah. So
okay, go back to the emu.
Yeah, the emu. So this takes place in Australia in 1932. They had a migration of something like 20,000 emus. Now, where they migrated from, I don't really know. I don't know that part, but they were destroying crops. There was a big drought, and they were ruining fences and all this. So the military decided to go to war with them. This is an actual thing. And they got troops together. They put together these troops, and they gave them 10,000 rounds of ammunition. And they gave them
the emu. Can I just say the emu troops? They get a little patch on their shoulder. What do they have on this?
Well, here's the crazy thing. They gave these Australian soldiers Lewis machine guns and 10,000 rounds of ammunition. Here's the amazing thing: the emus won that war. They won. If you look it up, the emus were victorious in a battle against human soldiers with machine guns. They say that the emus were quite talented. They were so agile that they would group together and they would scatter, and they could actually dodge bullets. I mean, they were like superhero birds. And so the soldiers at the time had apparently said that they had killed like 1,000 of these out of these 20,000, but it used all these rounds. So it became like this embarrassing moment for the Australian military. And anyway, so the birds won. And no one's for war, right? Like everybody's, I would hope, anti-war. I know you and I are. And I think, but yet if you were going to go to battle and you knew that, you might not ask the Australians for help. I'm just saying. I mean, they lost to birds. Hello, everyone. Welcome to Reverb Podcast this week. We are excited to be here, Todd and myself, and our guest today that we'll be chatting with briefly. This is the podcast where we talk to fascinating people about the way they think and the wisdom they've gained along the way. So, Todd, excited about the guest this week. You know who's coming on the show?
I'm not supposed to be surprised.
Yeah, no, you're not.
It's some sort of doctor. It's a doctor.
Yeah, it's a doctor. Yeah, we won't reveal yet, but yes, no. This week we are pleased to have Dr. Bill Wagner with us, who is a hand surgeon here in the Northwest. He's been with the Seattle Hand Surgery Group since 1997. He's one of the most well-recognized surgeons in the area. He's quite well-known. And a lot of people think he's from Seattle because he's so well-known here, but he's actually from Indiana and went to Notre Dame. So we'll have to talk to him about that. So we're excited to have Bill with us today, and we're going to get started with our guest here shortly.
Excellent. Looking forward to it.
All right, here we are with Dr. Bill Wagner. We made it. We're here. So thanks for being on the episode today. We appreciate having you here. We obviously have been longtime friends, so we know some things about you, but I think there's a lot of things we don't know, and we covered some of them in the intro. But we always thought, okay, did Dr. Bill, did he want to be a surgeon when he was 9 years old? Like, what did you want to do when you were a kid? Like, is this how it all started, or where did it start?
Yeah, I remember being at a friend's house, my friend Danny, and playing at his house in grade school. And his dad was a doctor, and he'd come home from the hospital, and he just seemed happy and friendly. And I'm like, whoa, I'm going to be a doctor. That was my grade school. And
really,
wow, I always since then wanted to be a doctor when I was little. And yeah.
Oh, that's amazing. So you were like all the way back to elementary school. You saw that and you thought, that's who I want to be.
Anybody in your family a doctor?
No, nobody in my family. A lot of attorneys, judge, all kinds of things like that. No, nobody in my family. It was that initial part. And then I was a dummy in high school and walked through a glass wall playing golf, of all things, trying to get back and finish 9 holes, and the sun was setting, and I cut my quadriceps, and I met an orthopedic surgeon in Indianapolis who took care of me, and I was like, oh, well, I want to be an orthopedic surgeon. That sounds pretty neat.
So that's wow. So you were pretty seriously injured, and you're like, oh, I want to be the guy who fixes these problems. So
and you never wavered at all on the doctor direction?
No, I kept on that. I kept on that course in high school, or I guess in college. One of my friends I got to know quite well in college, her dad was a hand surgeon, and I became really good friends with their family. And I remember he just, he was a mentor like a lot of people have, and I was lucky to have. And that was a big part of becoming a hand surgeon, was having a mentor.
So you decided on that specialty pretty early on then.
Yeah.
I mean, in college, I thought, gosh, now I think I'm going to be a hand surgeon. I remember being over at his house one night, hanging out with my friend, and he said, hey, come here. And he had these books open, and he was studying for some surgery he had the next day, some complicated surgery of making a thumb out of a toe. And he was planning out this pretty intricate surgery, and I kept asking questions, and he kept giving answers, and I was like, boy, I'm going to be a hand surgeon.
Wow. Wait, okay, we got to
wait a second. It sounds like you were like 50-50 on being a toe surgeon at this point.
we got to come back to the thumb of it, because I think that might.
Yeah, we're not leaving that one alone here. We're going for it.
Cool. I think I had a girlfriend had a thumb at his toe.
Yeah, every once in a while somebody loses a thumb, and thumbs are very important. And if you don't have a thumb, it really changes how you interact with the world, because so much of what we do is
you need that.
You need our hands and with our eyes. And when we're using our hand, a lot of the function is your thumb. So
what toe is that? You're not taking the big toe.
The big toe, yeah.
You can take the big toe. The very sort of fancy Ferrari way to do it is to take the big toe, then you shave about a third of it off, and you shape it to make it look like a thumb. A less invasive way is to take the second toe over, but it doesn't look as much like a thumb. So it depends a little bit on the patient.
The aesthetic. So it's sort of the aesthetic is part of the question.
Right.
Okay. And can they feel their toe as a thumb, or is there, the nerve?
It works.
Yeah. It's something that you hook the bone up, and you hook tendons, then you hook blood vessels up, then you hook the nerve up. And, depending on how old they are, if the younger the patient, the more they can get pretty complete recovery. If it's somebody who's past whatever age, 60 years old, 50 years old, nerves don't regenerate as well. And so the younger the person that has that injury, the more likely they could get really good function or full function back.
Wow. Okay. And the original thumb goes down to the foot at that point, because that's where it would show up? Or?
Unfortunately, the original thumb is usually in some piece of industrial machinery or lopped off in the Bering Strait or something like that, the Bering Sea. Yeah.
Wow.
And that was your introduction, your motivation on hand surgery?
Yeah.
Really?
Yeah, he was really, I mean, he'd already been practicing for many years. He was president of our national society at the time, and was just, but I was like, boy, this person's been in practice for 25 years and he's still studying the night before to make sure he gets it right.
Yeah. Avid learner.
Yeah.
Wow. And have you done a toe to hand, or what's it called? Is there a
toe to thumb transfer. I have not. That is not my practice. I've replanted several replanted thumbs in practice, put the own person's thumb back on. But that specialty, it's in our city in Seattle. It's a trauma hospital, Harborview, that has a special team for something like that, which different regions around the country have their special hospitals, which makes sense to become super specialized in replantation.
So when somebody refers to you as a hand surgeon, where do you stop doing surgery? Is it at the shoulder, or like where do you operate on for the most part?
Most of us from the elbow on down to the fingertips. And if you're in a big city like Seattle, like I am and we are, it's something that there are doctors for shoulders and elbows and hands, but elbow on down is what I do, and most hand surgeons do.
Yeah, but you once told me, though, that as a surgeon, you've largely been trained in almost every other type of surgery, right? I mean, if you were out in the wilderness and you had to do a different kind of surgery, you have skills there.
I am board certified in orthopedic surgery, so I could certainly, if I was in a different setting, I could fix hip fractures and broken bones all over the body. I don't think you'd want me to do spine surgery. That's something you want to keep doing through your whole career, but one could. And then you are, as you go through training, you do a part of your training is in general surgery and plastic surgery and vascular surgery. So you do get a broad part that then you narrow down, but that experience really does help out, as time goes on.
Right. Just to be able to see. Yeah. I always thought that's fascinating. You had to learn all of those. And then, so how long does it get if somebody wanted to be a hand surgeon today and went from undergrad to medical school, residency? I mean, what's the total time commitment somebody has to put in now?
Yeah. After medical school, which med school is usually 4 years after college, it's another usually 6 to 7 years after medical school.
Wow.
And that takes you through various practices and residency, and then
most of that you're in a residency in orthopedic surgery or plastic surgery. Probably 80% of hand surgeons go through orthopedic surgery, and then 1 or 2 years just focusing on the upper extremity. A lot of it the elbow out to the fingers. So it's 6 to 7 years after finishing medical school,
and then you kind of turn pro, so to speak, right? Where you actually, I was going to use the phrase get a real job, but that's not exactly appropriate here. But that's when you become like a doctor on your own, you join a practice, that sort of thing.
Yeah, there's certainly, as part of training, like in every profession, there's stepwise parts that you're getting more independence and working more on your own. In the final year of what's called fellowship, where I'm already a board certified orthopedic surgeon, there's a lot of, where I was in Indiana training, there was a lot of independent work. We were in a busy emergency room that had all the hand referrals for most of the state. So we had an operating room in the emergency room that I did 300 cases on my own in my fellowship year. So you have a lot of experience and mentors and people coming in to help or not. And then you hope when you join a practice that you have other partners that you can continue to learn from, sometimes teach a little bit, but mostly learn from. Yeah.
Are you born without the squeamishness, or is it something you get used to? As far as
the blood thing, I was curious about that. Like, at what age did you realize, that doesn't gross me out? Like, I'm not freaked out by blood.
Yeah, no, I think there's a learning curve to that. I think some people probably are born with that. Some people will never get over that. I remember the first time I was in surgery, I was first year in med school, and I was visiting a community doctor who was a surgeon, and he was an orthopedic surgeon, and said, okay, we're going to go into the OR here. They're doing a hip replacement. And so, he walks me in. It's one of his partners doing it, and it's a full room of nurses and staff and anesthesiologists, and I come in and they're putting the part of the hip replacement that goes in the thigh bone in the femur. And it's probably 6 inches long, and the patient's on their side, and they're just hitting really hard with this big metal hammer, hitting this thing into the thigh bone. And the nurse looked at me and just could tell I was getting white, and put a stool underneath me and said, "Why don't you sit down?" I'm like, "Yeah." So there was a learning curve on that.
Okay, so you did have moments where you're like, "Whoa, that's
right." That first time I was really in surgery was not a subtle surgery. So maybe if I'd been into something smaller, but that was pretty dramatic. Yeah.
Boy, okay, so I'm never getting a hip replacement. That's what I picked up out of this.
But in a little red wagon, we'll carry you around the neighborhood. It'll be fine, Todd.
The thing that sort of strikes me about that is that surgery always struck me as a very precise and almost dainty process, but then it has these kinds of moments to it.
Yeah, and they're different. In my training as an orthopedic surgeon, we would work from things like putting a finger on, which is as dainty as it can get, where you're under a microscope, things are magnified under the microscope 10 times. You're nothing is moving. Tiny movements of your hand are helping sew little tiny veins in the finger. And then you'd be in the ER at Harborview, and someone would come in a car accident and their hip was dislocated, and you would get up on the gurney and stand up above them on the gurney, get your arms underneath their hip and their leg, and pull that hip back into place. Oh. And it's pretty physical. And so they're parts of big bones and that need more physicality. The hip replacement part, there's one part that it's like that, where you're shaping the inside of the bone, where you do use a mallet. But there's a combination of dainty and physical. And what I do in hand surgery, it's for sure more on the dainty side most of the time.
You got to be really steady hands, and I think, just to be able to, is that a big part of it? Just being able to make really minute sutures and that kind of thing?
It is, yeah. Mm-hmm.
Yeah. I think I would be terrible at that.
Yeah, you want to,
your hands are shaking just holding, like a glass of water or something.
Yeah, you do want to be careful on your caffeine intake if you have
right. You don't go with like 2 Red Bulls into a surgery. Yeah. You can just let's go.
It's a real thing. Yeah.
So do you drink coffee ever before a surgery? I know alcohol is like 24 hours or whatever, but
yeah, no, I do. I do in the mornings. If I have a surgery where I'm going to be sewing little nerves or blood vessels in a finger that's elective, which would be if somebody, say, cut their finger and cut a nerve and we fix it within a week. That one I certainly wouldn't gear up on the coffee right before that case.
Interesting.
If I'm on call in the evening, I typically wouldn't, and doing something emergent, I wouldn't be drinking coffee anyways. But yeah, there is a part that you learn over time, how to get your body ready for certain procedures. But most of the time, you're not thinking about that. But every once in a while, you do need to.
Sorry, I'm going a little bit deep here. But when you're like reattaching blood vessels, do you sew like around the blood vessel? Is that where the sutures are to connect it all? Okay.
Yeah, like imagine you have a hose that's cut in two, and you had some big piece of fishing line. You would be looking down at the top of the hose, and you would sew the back part that's called the back wall of the hose, the farthest part away from you, with the suture, and then you would come and do the 2 sides, and then you do the part that's closest to you. So you're working your way around the cylinder, and you pull the edges of the cylinder together, and you want to make sure that you don't pull a part of the cylinder inside, because that'll block the flow of the blood. So yeah, it's sutures around the outside, and when we're doing that in, say, a blood vessel in a finger or a little vein in the finger, it's probably 5 or 6 sutures. It's not 20.
And how thick is the blood vessel? What's the diameter?
Yeah, a millimeter. It'd be hard to see, but like a little vein on the back of my finger, maybe you could see. Yeah, it very small. Yeah,
so
millimeter.
That's the reason for microscopes. Then you're using you're okay.
Yeah. When you gave that example, I thought, I go right to the duct tape. I don't even stick around for the little sewing aspect of it. So
yeah. Now there are duct tape. For nerves, there are duct tape versions of biologic glue that for a nerve that is not having a hollow tube on the inside, it's solid. That one you can put a glue of sorts on the outside, and it's actually probably aligns it better and is less traumatic than passing a needle. And the little tiny vessels, you have to pass a small needle that you can't even see the size of the thread. It's teeny.
Wow. So if it's glue, now I think I could have been a doctor if there's glue involved. I really,
we would have to to be involved in medicine.
And you didn't consider any other sort of hand specialties like pedicures or handball or anything like that? Nothing came up?
No, just, stuck to the surgery part. Yeah.
Well, I am impressed.
You have to be careful with your hands, probably. Seriously, once you're a hand surgeon. Like, I remember a pilot friend of mine would fly fishing, and his brother-in-law flipped the line back, and the hook caught in my buddy's eyelid. And luckily, didn't hurt the eye. But the moral of the story was he was that close to ending his career. I mean, like, if it had damaged his eye, he might not be able to fly. So
yeah. I mean, there are some things to think over time. I grew up in Indiana, so playing basketball was part of my life. That's how in the winter you stayed sane. We didn't have ski slopes, so we played hoops. We got together and played all the time, and you kept doing that into adulthood. And all of a sudden, I'm in my mid 40s, and you're not quite as, you hurt more things, you sprain more things, you jam your finger really bad. And then you see enough patients coming in with just really messed up fingers from that. And I say, well, maybe I won't do the basketball thing anymore, probably for a lot of reasons. So yeah, there are a couple of things I backed off on purpose, but not too many.
Yeah. I mean, you're a great snow skier, obviously a great water skier. I mean, you're an all around super athletic guy, and tennis too. Like, I mean, you've been to nationals many times. I can't even. I'm good. I'm bad at all those things I just listed. I'm so impressed, but
it's not because you're worried about your hands, is it, Gary?
No, I'm just terrible.
You're a super dude.
Yeah, that's right. Well, I'm curious that you've been. How long have you been a hand surgeon now? Is it
coming up on 30 years? Just about 30 years.
Okay.
Yeah.
And I was looking at your bio. Are you still a consultant for the Seahawks and the Sounders and some of the teams?
Yeah, I'm a consultant for the Seahawks and the Sounders and the Kraken. I cover all the Seattle University athletics.
Okay.
So it's, I do those things. It's fun to consult and take care of all different levels of athletes.
Do you have to go to the games periodically, or does it all come to you? Like, how's the interface?
No, there are doctors, usually orthopedic surgeons, and also primary care sports medicine doctors who are at the games that need to be at each of the games, and they have a little broader area of coverage. If somebody gets a neck or a spine injury, they also are, well versed on that, and so then I'm more detached and seeing somebody, sometimes the day, but usually the next day, or sometimes the next few days.
It's like a post-game injury. These guys and gals are coming to you saying, "Hey, here's what happened," and okay, gotcha.
Yeah. Yep. And sometimes it's just an opinion. Sometimes it's a second opinion. Many of the pro athletes have agents, so the agents have people that they use all around the country.
Okay.
And so you're just interacting and helping in whatever way you can, as far as, helping out somebody like that. And they have very, interesting, different needs for getting back the same season, or, is it a contract season or not? Because that affects their treatment, and whether they want to get back soon, or if they've already had their contract, they may want to recover. So there are a lot of factors to figure into how to treat, all of us. And that, for pro athletes, that's a niche of how to figure out how to help them.
In just your mind right now, can you search out the moment of a surgery of one of the Seahawks players this year that you've now told everybody that's the reason we won the Super Bowl? It's because of that repair you did? Was there a moment that happened?
No, I can't.
You can't account for that? I was hoping we could tell people, Bills won the Super Bowl because one player can catch now. So, all right, well, we tried.
Are there any stories you can relay about really interesting or unique situations in surgeries?
Yeah, what's like the weirdest thing that's ever happened to you in your career?
I wasn't going to go weird, but let's go that way.
Weird. I would say on a routine basis, at this point, there's not much that's weird or surprising. I would say that the things that are dramatic, the patients, the situations are often on call when people get infections in their hand or arm, and there's some there are different type of infections, either in people that have medical problems, or a lot of people we take care of on call have substance abuse disorder and are injecting various things into their arm with needles that aren't clean, and then bad infections happen. And so probably some things that sometimes, many of those are little collections of infection that we need to either consult on or surgically open up that are fairly straightforward. But then sometimes patients get really sick really quick. In the press, it's called flesh-eating bacteria. But it's in the medical jargon, it's necrotizing soft tissue infection, which means that these bacteria spread very quickly from an extremity, in my case, an extremity up onto the trunk in a matter of an hour or less. And once in what I do, once that infection gets up to the level of the shoulder, it gets onto the chest, all of a sudden it's a 30% mortality, meaning there's a 30% chance they could die. Yeah. So some of the most urgent things I do now are just, we have to open these areas up and sometimes, all the way from their palm all the way up their arm, up to their shoulder to get the infection somewhere to go so it doesn't go up and hurt them. So that'd be something that sometimes you get consulted, and usually those people are pretty sick, so it's not necessarily a surprise.
Where does this flesh-eating virus come from? I mean, we've heard of that, and it seems pretty rare, but it comes up once in a while. Where does it source from?
Yeah, it's a type of bacteria, and there are several different types that can do it, but it's a cousin of a bacteria that we all have called streptococcus, that we all have all over our skin right now, and it's a different variety that often the people that have that are ones that are in a place where their normal defenses aren't as good as your and mine because of various medical conditions, or maybe poor nutritional status because they're not eating. They have their substance abuse disorder, and they have a hard time doing a lot of the things we all need to do to keep ourselves healthy. So their immune system is a lot less. Or somebody who has diabetes, patients that have that have a harder time fighting infections. And so there's usually a reason that somebody has that bacteria already on them. And then when it gets under the skin, that their body can't fight it. That would be pretty uncommon in the three of us, for example.
Okay. Yeah. You always hear about that. So, so obviously for confidentiality reasons, you can keep this super generic, but has there been any really strange scenario where somebody had an arrow through their hand, or somebody had a sickle? I mean, anything just really odd that you're like, that doesn't come through here very often.
Yeah, feel free to use pictures, Bill, if you have them.
Yeah, that's a good question. I can think of a patient that I took care of that was, using methamphetamine and fentanyl and helping his buddy work on a car. And he had this ring that came off his ring finger, and it was this huge devil dragon. It had these big wings, and it probably was as big as big gumball. And he was working on the car, and he put his hand in by the fan and the fan belt that was going, and the ring caught in that, and it spun around his finger with this gargoyle of sorts spinning around, and it just rotored, and the ring finger hurt some, but the poor middle finger and the small finger were just like you put them in a blender. So that was interesting. I got called from the ER on that one to say, hey, can you help us get this ring off this patient? And usually they do that. Well, can you just make him relax? And they're like, no, he was sort of coming off, he was in a different mental state, and so there was not going to be any doing that in the ER. Then when I got there, and they finally got an X-ray, is the two fingers around it the bones were just they were destroyed and destroyed and destroyed. So I had to use a special. That ring was so thick, there was no thin part to this gargoyle ring, and I had to use this special spine, a diamond cutting small saw to saw that ring off his finger, and then repair some blood vessels because it had ruined those, and repair bones. And I used about 20 pins in those three fingers to hold the bones together. And he came back and saw me once, and never saw him after that. So somehow those pins are either in there still, or probably they've made their way out, or
Oh, geez.
Would you
would normally take those out?
Yeah.
Yeah.
Okay.
For that, yeah.
Oh, wow.
So when you're doing that, is it, like an ER situation, you don't have really a chance to sit back and sort of plan it out and think through how you're going to do it. Is it just, you take a step, you fix the step. Take another step, fix that step. Is that the thinking on that?
There's a general plan when we're doing that of, boy, I've got to clean things up so it doesn't get infected. I've got to get the bone in a good position so the finger points the right way. I've got to make sure these soft tissues that let you feel a nerve or let you move your fingers, the tendons, that those are connected as well as they can. And just that those years of training, and boy, when I was in the ER in my fellowship, I saw so much and did so much with plenty of help, but also on my own, and just felt really confident even then in it. It gives you a way when you see something different to be able to work through it and have confidence that, if you persevere and sort through it and don't get flustered, that you can get a good result, or at least do your best job for you and the patient.
Wow. Shifting gears, I've been thinking about that just with Todd always says I'm shifting gears all the time, but when you think about young people wanting to go into medicine today, and you've obviously been on an incredible journey, you're very successful at what you do. What would be your advice to young people that want to go into medicine today, and how do they think about either your field or just the direction of medicine in general?
I think it's a great field. I mean, I'm blessed. I love what I do every day. I love the interactions I have with people. I think I would tell them right away that there are so many positive interactions you have with often a wide variety of very diverse group of patients in, age, ethnicity, gender, every category you could imagine, that those interactions that you get are what really just fuels and makes it such a rewarding profession. And it's challenging. Throughout history and the training, it's like many professions, it's not easy at times. It's time consuming. While you're in the part of training, if you can, make connections with patients, with people you're working with, if you have good support and relationships in your, outside of medicine, that all helps. But I think it's an incredibly rewarding field. There are a lot of challenges with just equity and how healthcare is delivered and how healthcare is paid for, in who runs or manages you. And in the past, many physician practices were private practices that were run by physicians, sometimes for better, sometimes for worse. And now that's rarely the case. And so it's something that you have to also be able to fit into whatever system you're in. But I think it's incredibly rewarding. The problems aren't going to go away. We're still going to need doctors, nurses, techs, therapists to do work, even if we have, the highest that we can of AI and all kinds of information that can, help us figure out things quicker. There's still going to be parts that need to be delivered in a human way. And so I think that profession is going to continue to be rewarding, although definitely it can be challenging to get there.
Yeah. It's like there's a business side of this, right? I mean, obviously there's a business side, and that's changing considerably as you were mentioning there earlier. A lot of things are changing. So it's not unique to medicine at that, but I can imagine the structure of it is something very different than when you first started 30 years ago.
It is, yeah. There are very few practices that aren't part of a larger entity. The practice I'm in happens to be all hand surgeons, and we still own our own practice. I think we are probably the only group in America like that.
Really?
Most have been incorporated into big orthopedic groups. Many of those orthopedic groups, at least in middle to big cities, are incorporated into a bigger entity of hundreds of providers, doctors, nurse practitioners, PAs, and nurses. And if you're in a smaller city, then often things are run now by hospital-owned or healthcare company-owned places. So there aren't many places anymore for private practice. There are plenty of orthopedic groups that still are. I don't know of many hand surgery groups that are still on their own or any. Yeah.
Wow.
Yeah, there's been a lot of consolidation. Yeah, we've noticed that. So, okay, so let's chat about what you've had a chance to. I know that you've coached young people, you've worked around young people for years in terms of just mentorship, and if you if you were going to sit with somebody young today and say, here's one piece of advice that was passed on to me by somebody that's been really useful in my life. So it doesn't have to be about being a surgeon. It could be just life in general. What would that nugget be?
I think things have been passed down. I can think of different people in my life. My parents passed a lot to me about relationships, about giving your time to others in whatever way that is. There are a lot of ways to do that. There's a part, for my dad and others about grit, about, boy, you've got to work on this project and you got to spend time and you got to keep working at it until it gets done and gets done well. There's a part of just connecting to others. In my profession, it was my mentor who I talked about earlier, the hand surgeon that I knew, who later I trained with as a fellow. And you watch how he interacted with patients and what connection he made, even on someone he would see a couple of times. And, I think it applies for whatever you're going to do in life is making connections with people that you're in the moment with. And that, the interaction that goes both ways is, if you're in a profession like I am, it's often, oh, you're the doctor and here's the patient, but it's better that it's, hey, you're two people and we're learning about each other. We're getting information. We're giving information. So I think, for folks, I'd say make connections with others, keep developing those strong connections. If you're lucky and you come from a family or other support system that's strong, keep nurturing that and appreciate that and be thankful for that. And, we can all learn, let others know about that.
Yeah.
So I'd say those personal connections, professionally or personal ones, longstanding, those are what sort of rewards, I think, both sides, and that'd be a place to start.
That's great too, because a lot of times when we all look at young people now, and obviously they're growing up in a totally different digital world. They got phones in front of them all the time. So I'm always trying to get my boys like, hey, let's put the phones down. Let's chat. So, But by the way, I know you're also a good golfer, Bill, and as you know, golfing with your kids, that could be a great way to just have a conversation. So,
yeah,
that's been fun. But okay, so we also like to ask some questions that just get to the heart of like maybe just the way you think about some other things. So one of our favorite questions to ask is about if you could go back in time, any part of history, and meet anyone you want. So they could be alive still, they could be passed away, but who would you want to go back and sit down and have a cup of coffee with, or whatever they drink at that time? And what would you ask them?
Well, I have a couple of people come to mind, and one is somebody that recently last probably 15 years got to research a little more, get to know, which is Abe Lincoln.
Okay.
Abe, once a year I give an Abraham Lincoln speech, and
do we have that? Do we have that?
We have the speech?
I don't have a speech, but once a year,
oh, look at that.
Once a year, I become Abe Lincoln for a night.
Lincoln, wasn't it?
Yeah, come on.
Right? So I become Abe Lincoln for a night and give a speech and try to relate it to something that's going on today. And people that have been over the course of time have been great people. What they say, it doesn't matter what time period you're in, it reproduces. So, for Abe, I would like to have a conversation with him today and say, gosh, Abe, when you were assassinated, you were just have been elected for your second presidency. You're just starting it. The Civil War had just ended. What would you have done in those next 4 years after the Civil War? Because there was a way to reconstruct America, and there are a lot of different thoughts on the best way to do that. And here's somebody who is really championing everybody's rights, and at the same time, he did respect others, the South's rights to have their traditions, and not respect, but he was very much trying to be someone who's a centrist. And so I would have liked to know what would he have done, to reconstruct, and would have changed anything on how our country, from the 1860s up until the World Wars, how it went. So that's
a great, wow, what a great question.
Yeah, he's a singular figure in history, in American history, where he had to make some very, very difficult decisions. And obviously we weren't there, but in the context of sort of what's happening today or what the rest of history in America has been, he was somebody who was right there making the choices that determined where the country went in a big way. So
yeah,
that would be interesting.
If I went on that trip with you, Bill, like if we got to go together, the only thing I would have done probably though is I would have brought the penny, and I'm just like, hey, I'm sorry, we're getting rid of this. I apologize.
I know.
I actually think about like as spectacular as a person as Abe is. Why did we put him on the penny? I mean, he's on the $5 bill, but I mean, we should have put him on the quarter. I mean, well, Washington's on the quarter. I guess I don't know.
The penny used to be something, though. Back in the day.
Yeah, I know.
It did.
So bad. He's looking down right now, going, "There's pennies on the ground. They're in a 7-Eleven dish to round up. I mean, what are these for?"
Yeah. Pennies don't equate anymore. Yeah, I know it is. It's a shame.
Yeah, it is a shame.
Yeah.
But, well, that's a good one. Abe Lincoln. That's solid.
So here's a look. You sound like, that you were on this path you were on career-wise from very, very early times. Was there ever a serendipitous moment that happened that made you go left versus right, that if you look back at it, it could have gone either way? Back to the coin flip situation?
In my case, not for my career in general. I really did I got in this path, and then one step and the other step. There was a why in the path, and I went to medical school in the state where I lived, Indiana, and it was a good medical school and great place to train. And boy, cost-wise, I looked at various places, the big famous places, and it was 5 times as expensive. And for me, I didn't see it penciling out. The next step going into residency, there were options, and from various places from the Midwest and the East Coast and Seattle. And I fortunately come out to Seattle and worked there a summer in med school, and I got to know some of them. And so during interviews for residency, which is determines a big chance where you might live the rest of your life, to be honest with you. It was coming down between some places in New York and the Midwest and Seattle, and had to make a decision on where to go. And there's a matching type process, so it isn't that you have all the deck of cards, but there was University of Washington at the time was not in this regular match system. They were on their own, and if they called you and they wanted you, you had to say yes or no. And so I had been on a trip to the East Coast. It was right when the first Iraq war was in the 90s. And I remember I was down interviewing at Duke. I was staying with some friends from college who were in grad school down, and we had tickets to the Duke, North Carolina basketball game in the Dean Dome, and I was all fired up. And then we bombed Iraq that day, and that game got canceled. So I was like, and then I had an interview at Duke, and I was up in New York at a place called Special Surgery, interviewed there. And I'd been on this interview trail, and I was driving, and it was all this war. It's sort of like how it is right now. That's what's a lot of our mind, what we're thinking about. So it'd be a topic, now if we were interviewing for something. And I'm driving back. I got done the interview at about 5 p.m. I'm like, I got to get back to Indiana. I just drove through the night, and I got back, and I had a call on my answering machine, the old school answering machines. There was Dr. Larson from University of Washington, and he liked to offer me a position in their residency, and I had like 2 days to accept. And I called him up first thing in the morning. I'm in. And I just, that was a why in the road of like, am I going to be in New York or here or there or Seattle? And it was yes on Seattle. And I've been living in Seattle more than half my life now. So that was sort of the why in the road as far as the where of my life, and which is responsible for why I'm talking to you guys right now.
So if he hadn't called, you'd be elsewhere. You'd be East Coast, probably, one place or the other.
East Coast or Midwest, yeah. Mm-hmm.
And what brought you out to the summer job in med school? Yeah,
actually, this same mentor in hand surgery, he trained about 10 hand surgeons a year, and I was at his house one night with his kids that I knew, and he was having a party for the 10 hand surgeons he'd trained that year, and I was talking to one of them in the driveway. And he said, gosh, what are you doing? I said, well, I'm in med school. I'm going to look into orthopedics. And he said, well, you should come out, Seattle and do a rotation. I said, okay. And And then I did, and I ended up staying that person in the driveway. He said, well, I got a room if you come out. And then I called him and said, oh yeah, you can stay in this room. It's actually very close to here, to where I live now. And so I came out to do a month at Harborview, and then ended up staying. And that person in that driveway that I stayed in the room in Seattle became my partner for 30 years, and he just retired. Wow. So it was
okay.
Yeah, that's how I ended up in Seattle.
Yeah, that's the match day thing. You reminded me of that I wasn't really familiar with that until recently. We had a friend that went through match day, and it's interesting. It's like you have your first choice, but you don't know whether you're going to get it, and they just match you. So I thought that was a pretty fascinating process. That's kind of unique to medicine. I don't know if there's any kind of except in any other field, right?
It's a unique day, and it's a happy and a stressful and sometimes a sad day. And you all are together at least back in the day, you were all together and had a big party on that day. And it was like everybody on that day, that was a big, where's the rest of your life going to be type of feeling. So it's a very big day. Yeah.
It's really interesting. My son-in-law went through that. So, and he wound up where he wanted to go. So.
Since we're coming up on April Fool's, Todd wanted me to ask you, what does April Fool's Day look like in the operating room? Is that applicable ever? No?
No.
Really? No, just
maybe in clinic, seeing patients in the office, but in the OR, I mean, we have, the OR is somewhat, there are parts of it that are very serious, making sure we operate on the right site.
Thank you for that.
Extremely serious. Very repetitive. People, you've already asked me that. Yes, we'll ask you probably 5 more times as part of the system. And then there are parts that are, you have good music playing, and that keeps things a little, just a little more light. And you respect patients if they're awake, and try not to have anything, too loud or offensive. Operating room.
You guys ever use the theme music from like ER or any of those TV shows? None. No, a lot of Mount Joy radio and
okay. Mm-hmm. And never, hey, let's put this toe on the little finger for him and see what happens with it.
No, we don't do. Whoops, there it goes. Or something. No,
you don't fake that. Whoa,
that's
gonna leave a mark. That kind of conversation with a patient there.
No whoops to the OR. Yeah.
Bill, one last question before we let you go. You've been really generous with your time. Indianapolis 500. We know you have a big Indiana, obviously, family back there. How many times have you been? And is it since you were tiny, or how many?
Every time? You've been every time?
I've missed twice. I missed when I graduated from college. I was in Europe traveling, and on that Memorial Day weekend, I was in actually Monte Carlo. And there's the Grand Prix of Monte Carlo. Monaco is that day. So I missed one in 1983 when I was traveling over there, but I was at a car race that day. And I missed one when my daughter was born on May 15th, my first daughter. So I did not go out because my wife was due right then. I did not go out for that one. So I missed only a couple. So I've been to 50 or so races. First one in 1973. 50 or so.
Wow.
Yeah.
Really?
Have you ever wanted to race now that you've seen so many races? You ever thought it'd be fun to be a race car driver?
Yeah, I would love to go around the track with somebody. I've never done that. I probably could figure out a way to help make that happen. And I probably would be. I mean, I like to do things fast, but I have a little governor when I like skiing or water skiing, and we all know those feelings. I feel I feel like my governor would kick in with racing a car. Just looking now at what when you see a TV camera and
how fast
the car anymore and what the driver really looks like.
What are the cars going? What's their speed in Indy?
On the Indianapolis 500, which is it's a big track. It's fast. It's an oval. It's actually a rectangle with rounded corners. They go 240 on the straights, and then through the turns they go 225. And so when they qualify as fast as they can, their foot's fully on the gas around the entire track. Yeah.
Wow. Well, I was in this. Isn't that speed? But I was in a NASCAR, one of those get-togethers someplace at a track, and I wasn't driving. I was in the passenger seat, and there were other cars that were just an inch or two off at 170 miles an hour. It was just incredible.
Yeah.
Wow. Yeah.
Yeah, I'm quite a spectator fan that way, but being in the car, I would like to do it once, and I bet I go, okay, that was good to do once. Yeah.
Or zero.
Yeah.
Or zero. Yeah.
Yeah. I mean, I got nervous the other day going down the big hill in the neighborhood on my bike, and the brakes were a little soft. So that means I don't think I would do so well in the Indy. So that's great. Well, Bill, thanks. You've been super generous with your time. Thanks for joining us.
Thank you.
Appreciate it. Just thanks for all your wisdom and your friendship as well. So we appreciate it.
Absolutely.
Thank you.
It's been great having you. Thanks for your time.
Thanks, guys.
Okay. See you, Bill.
Bye.
Take care. All right. Well, welcome to Reverb, the podcast where we interview. No, we don't interview. This is where we get to talk to fascinating people about the way they think and the games. Hello, everyone. Well, okay, you guys.